And welcome to the stage, Ciara Pagden. One in 7 women will be diagnosed with breast cancer in their lifetime. Developments in early detection schemes and treatment options have ensured that survival rates have improved significantly over the years. So much so that a patient diagnosed with breast cancer that's localized to the breast has a survival rate of over 97%. However, there's a group of patients diagnosed with breast cancer that has spread to distant sites in the body and that remain extremely vulnerable with a survival rate of less than 30%. It's this group of patients that my research focuses on, with the overall aim of identifying the key drivers of this aggressive disease. My research team and I believe that microRNAs may hold the key to this. MicroRNAs are teeny molecules that exist throughout your entire body and play a part in your body's everyday function. In cancer patients, however, microRNAs exist in really abnormal levels. This happens both in the site of the tumor and in the areas that the cancer may have spread to. MicroRNAs that exist in really high levels in cancer patients are considered cancer promoters, whereas microRNAs that exist in really low levels and their function is therefore lost, they're considered cancer inhibitors. The abnormal levels of both cancer-promoting and inhibiting microRNAs assist the cancer in growing, surviving, and spreading throughout the body. So how does knowing this help us improve the lives of that vulnerable group of patients? We can harness the power of microRNAs. Of the thousands within the body, I've identified 9 that stand out and show immense promise as tools that we can use. First, I will pinpoint the abnormal levels of these microRNAs that correspond with patient outcome, such as a patient's response to chemotherapy or the likelihood of their cancer spreading before it's even done so. Using microRNAs as patient monitoring tools will allow us to identify that vulnerable group early and ultimately inform the decision-making of the doctors who treat them. But we can take this a step further. We know that microRNAs in breast cancer have gone completely awry. So I want to ask the question, if I restore these microRNAs to their healthy levels, can I reverse some of those nasty cancer characteristics? Over the course of my PhD, I will develop and test a microRNA-based therapy using these 9 key microRNAs in hopes of improving our treatment options for advanced breast cancer patients. Thank you.